Okay, we're talking about this SI joint, the thing in the back where the low back connects into the tailbone area and you're like, is it my low back? Is it my tailbone? What is hurting? This is traditionally known as your sacroiliac joint. Not that you need to worry about big terms or even know that. Ultimately, it doesn't have a lot of movement at all. But what we do want to be sure of is that there's not increased tension and increased stiffness at that joint, and that it's strong around it. Ultimately, mobility and strength is what's going to help you to function better, not necessarily digging something out or releasing it, because that's not really what happens anyways when we foam roll, but we really want to be intentional of what connects around that area. So we're really going to focus on the glutes because those are really what is connecting into that tailbone area, that SI area. And if they're not having good mobility around the hip in general, it can cause some increased tension and pressure and maybe some unnecessary pressure that you're feeling in the back of that SI area. So I'm going to give you 3 of my favorite stretches and ways to make them a little bit more active so we get a little bit more out of it. Okay, so the first one is going to be a little bit of an elevated pigeon stretch. So rather than just going into your pigeon stretch on the ground, let's first assess your range of motion. It doesn't have to be a chair. It could be a bench, it could be a couch, it could be a box, something where it might be a little bit easier. So it could be a little bit higher than the chair. I'm going to show you with my chair. So as I come into this, first of all, what you want to see here is that your leg does not have to be at this perfect shin angle as to what a lot of people believe. If you don't have good range of motion in the hips just yet, forcing it into that position is not going to help. So you want to go to what's comfortable so that you can get this other hip forward, okay? So we really want to get this other hip to come forward here. And if that means you need to move the foot in just a little bit more so you can slide this hip over even more, do that, okay? So I'm going to slide this hip forward here and with a straight back. So thinking of lifting that tailbone up, of kind of tilting these hips forward into my thigh. And then I lean just until I feel a stretch into my glute here on my left side is what I'm showing you. Now from here, I'm going to breathe and then I'm going to press down from this leg into the chair and push it away. So I kind of am going to allow my body to fall into it and then press it away. All the while I'm keeping a nice flat back and then pressing it away. So I'm kind of activating around that glute as well as I'm slowly getting into that range of motion. So that lengthening pressure as I'm leaning into it and keeping tension in my body actually helps to create greater range of motion in that muscle and in that hip as well. It's okay to hold and breathe there for a little bit, but then don't forget to do some of those active movements. So next we're gonna come down to the floor. If you felt good with that one on an elevated surface, stick to that. You don't have to do it on the floor, but I'm gonna show you just the same. So here, same thing, you do not have to have this leg forced out. It could be in a little bit, and then the purpose is to get this hip up and over, keeping this hip bone rolled forward toward this thigh and lifting and elevating into the chest. So nice straight flat back, and then I'm going to push my leg into the floor even as I keep my flat back and I lean forward and then press away. My hands are here to just kind of guide me, but I'm using my leg tension to kind of push and gently come forward. Push and come forward. Again, you can hold this for a little bit, about 1 to 2 minutes, and then do this active exercise. But honestly, you get a lot more out of that stretch if you keep it a little bit more active. And then you do this over and over and over again. Now we're gonna address some of the other muscles around the hip that get really tight, and that's your inner thigh, or what's known as your adductor muscle. So for this one, what you really want to make sure is that we're coming into the range that is tolerable for you, right? So I want to think of pressing my knee out and then the other foot can lift. So if this is where you are, that's fine, okay? You want to unlock the knee just a little bit so you're not forcing into hyperextension. So unlock that knee just a little bit, tension into that foot, opening in that knee, hold, breathe, stretch, And then we're rotating around and grabbing this knee into your chest, feeling a little glute stretch, and then coming right out, switching. Again, a little bit of tension through that foot, through that knee, opening this other knee, rotating and pulling that knee to your chest. So we're getting all around that pelvis. And then maybe you can start to go lower if you work on it a lot. And then you can come over, pull that knee into your chest. And again, we're keeping all of these stretches a little bit more active so that once we go into movement, which is what we ultimately want to do, we start to relieve that pressure around that joint, around that area, and relieve the tension in those hips. That's really going to help to take off some of that tension in that SI that you're feeling. If you love what you're learning, don't forget there's so much more that I have in store. So hit that subscribe button, check out the other videos so that you don't miss anything and you continue to learn and feel amazing within your body.